Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes of my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Azi, and I'll be sure to answer them on the show. Now, let's get started. Welcome back, guys. Today we are tackling a topic that is so common. Almost all of us have these, and that is stretch marks. And patients are so bothered by them. There's still so much stigma that is, associated with stretch marks. I'm getting so many questions about them, probably because it's summer and a lot of us are in bathing suits. But it's almost virtually every woman that I know.
Every single person.
I mean, I guess maybe not 100%, but 80 to 90% of people have them. So super common. Let's talk about them. Let's talk about what you can do at home, what you can do in the office, what works, what doesn't work, and why they even happen.
Yes, let's get into it.
But before we get started, guys, don't forget to rate, review, and subscribe. And if you're not following us on Instagram, check us out at More Than a Pretty Face podcast. We'd love to hear from you. And if you're not on social media, send us an email at morethanaprettyfacepodcast@gmail.com.
All right. So before we get into it, how about we start with a beauty and a blemish?
All right. You want me to go first?
Yeah.
Okay, well, my beauty is that my son qualified for a national tennis tournament.
What?
Which is such a big deal, and I'm such a proud mom. But my blemish is that I have to be on a 6 a.m. flight to Dothan, Alabama tomorrow morning. And it takes so long to get there. They're 3 hours ahead of time, and it's going to be interesting.
Yeah.
And tomorrow's 4th of July, so I'm hoping that the airports are going to be kind of quiet.
Oh.
But I'm looking forward to a mother-son weekend. I'm usually on trips with my daughter a lot, and I don't get to hang out with my son as much. So I'm super excited. And you won't believe this. I packed a rice cooker because he loves rice. I'm taking
cooking rice.
Well, I'm taking Persian rice and a rice cooker in my carry-on.
Okay.
It's going to be interesting. Me in Alabama.
Yeah, I'm excited to hear all about it when you get back.
I may not be a great tennis coach, but I will be very nurturing and nourishing as a mother.
I think you're a really good cheerleader.
Yeah, that's going to be my strategy.
Yeah. Aw. Well, beauties for me. Remy moved up in gymnastics, so she's in hot shots. So it's very fun watching her learning cartwheels and backflips on the bars, and she's always been a little monkey. So this is
she
the
must
perfect
love
route
that
for her.
And they look so cute, the little girls with their outfits and their hair. It's super cute.
All right, you guys, let's get started.
Yes, I'm so excited about this topic because I want to answer your questions at the end. But first, let's get into stretch marks that everybody has. What are they? And the way I like to describe it to patients is that they're almost like tears in the skin. So your body expands, or your tissue or your skin changes or gets pulled and stretched. The elastin and the collagen in the dermis, it essentially tears in the dermis. And so you can think of them similar to scars. When they first come up, they tend to be red. Then they can turn almost like a purple color or a brown color if you have darker skin tones. And then eventually they'll fade into this kind of white, silvery marks, as many of you probably have them and have noticed that. And they are quite common during puberty. We see them in teenagers.
Yeah.
But we also see them a lot in pregnant women. And they are common around the breast area, hips, knees, waist. But men get them too. And
let's talk about what causes them, because I will tell you, and I'm totally throwing my husband under the bus here. I got stretch marks at a young age on my thighs, and my husband always, at a young age, thought that meant I had been pregnant.
Oh.
Yeah.
You can only get stretch marks when you're pregnant.
I'm 19. No, I've never been pregnant. It's right. It's a growth spurt.
Right.
So let's educate everyone on how how you get them, what causes them.
Yeah, well, we talked about the rapid, stretching. So with growth spurts, just like you had. And certainly hormones play a role. So teenagers, as you're going through the hormonal fluctuations, high cortisol levels is one that is related to stretch marks. Sometimes people are not going through growth spurt, but for whatever reason they have high cortisol, and that can cause stretch marks.
Interesting.
Even applying topical steroids onto the skin for a prolonged period of time. This is one of the reasons why we're always cautioning people on overuse of steroids, because that can cause stretch marks also, and can thin the skin.
I knew it could thin the skin. I never realized that
Yep,
it could cause stretch marks.
It could lead to stretch marks.
Interesting.
And certainly, like everything else, genetics certainly plays a role. Some people just have more resilient skin, than others. And certainly rapid weight gain can stretch the skin too quickly and lead to those tears we talked about. And certain medications like corticosteroids that can thin the skin can lead to stretch marks. Even if you do everything right, you can still just sometimes develop them just genetically. They're like I said, quite common.
Probably in men, like weightlifting, like muscle.
Yeah, so
growth.
that could be a possibility. Yeah, so if you're really bulking up and you're stretching that skin and you're really getting big, that certainly could. But we also see it in the waistline when boys grow and women or girls develop breasts during puberty. That's a common area. Or sometimes with pregnancy, your body can rapidly grow. And with all the hormonal changes and that rapid stretching of the skin, that can lead to stretch marks too.
Yeah. Statistically, how common are they?
Very common. 80 to 90% of pregnant women develop stretch marks.
That's a big
which
number.
Is a huge number.
That's a really big number.
Get stretch marks when you had?
Thankfully, my stretch marks are on my legs.
Okay,
Yep,
but
so
never.
I didn't get them during pregnancy.
You did not get them. I did not get them either but I did get them during the teenage years.
Same.
And then 70% of teenage girls actually develop stretch marks, which is quite high also. And then about 40% of teenage boys. So certainly more common in women than men, but I have seen them in men, and they can be just as bothered. And you know what? Stretch marks do not discriminate against skin tone or color. So we see them in all skin types, whether you're fair skin or darker skin tones. Yeah. They can look a little different. So instead of, looking red, they might look, purple or brown. So that's one thing to note, that they can have different appearances based on how much melanin content your skin actually has.
And how new they are, right?
Right. So the phases. And, if you get them, when you first get them, they're going to be red, and they can stay red, like bright red. That's what really makes them stick out, I feel like. And so that can last for a really long time. We have the most amazing podcast community, and we want to thank you for being such a loyal listener. To thank you for being a fan of the show, we want to extend 15% off exclusively to podcast listeners. Just use code POD15. This is a special discount we're only giving to our podcast listeners to get 15% off your favorite products at AziMDSkincare.com.
How about prevention? Is there any way to prevent them from appearing?
Yeah, that is $1 million question and it's $1 million question because there's a lot of marketing ploys out there that claim prevent your stretch marks, do this, apply this, I don't know, put lemon juice on your skin so you don't get stretch marks.
Don't do that.
There's really no studies that show anything that's proven to prevent stretch marks, but certainly making sure you're not gaining too much weight, for example, or when you're pregnant, you're not gaining too much. But sometimes that's hard to do.
Yeah.
But what you can do is nourish the skin. So supportive care is what I say. You can massage, the areas, like if you're a growing teenage girl or teenage boy and you're worried about them because maybe your mom had them or your grandmother had them, you can use topical creams that just help nourish and hydrate the skin. So with shea butter, argan oil, hyaluronic acid, these can help hydrate the skin. And if we can hydrate the skin and strengthen the skin barrier, we can make the skin maybe stronger. But sometimes it's just up to your genetics and other factors that you cannot control.
Yeah.
So don't fall too much for those for those products.
Yeah, and I mean, I feel like especially young women, they feel so discouraged by them, but truly, I mean, you hear the numbers, 80 to 90% of us have it. Don't be so hard on yourself.
Yes, and that's a great point. And I think it is can be disturbing. So I do feel for patients that come in truly bothered, especially teenage girls. Your body's changing. All of a sudden you have breasts and your hips are wider. And now on top of that, you've got these red lines, all over your chest and your abdomen. So it can be distressing, but just know that you are not alone.
You're not.
A lot of your friends probably have them. And eventually they do fade. Even if you did nothing, they do fade. And I mean, I don't mean to be a Debbie Downer with preventing them, but there are some products that I think are worth trying. There's one called Bump Butter that is safe. It's just made with a lot of just natural oils that you can use for massaging. There are now products with cocoa butter and shea butter that you can use with massaging. You try to do the best you can, but sometimes you end up with them. The good news is there are treatments that we can do in the office too that do help. If you do get them, what you can use are retinoids. So either prescription Retin-A or over-the-counter retinol you can use. Unless you're pregnant, you probably don't want to use that if you're pregnant.
Set that aside.
But if you're not pregnant, then that's something that you can try when they first come up, because retinoids help boost collagen. They help with cellular renewal, and they can help particularly in the early stages. And if you do get them, you want to start treatment early on.
So with retinoids, I actually really like Lift and Renew because it's a serum and it's just as effective as like a prescription Retin-A or tretinoin.
Yes.
And it's almost like an oil base.
It is. Yeah, it's really easy. You just need a few drops, and you can get a lot of coverage with that. So if you're already using it, on your face maybe, but it's a great product to use because it rubs in so easily. You can use that to massage it into the stretch marks. Yeah, that certainly would be.
It's hydrating.
Yeah, that would be a good option.
What are some in-office treatments?
So I love using the V-beam. That's probably one of the most effective treatments, particularly in the early stages, and we've had great success with that. You can also do the BBL laser, which can target the redness. Sometimes just getting rid of the redness, helps camouflage them into the skin better. And so that's helpful. Also, silicone gel is another great option for over the counter, and that's safe in pregnancy. You can use the silicone gel sheets to apply to those stretch mark patches, or just the gel alone. I think the sheets work better. Yeah. There's a brand called Sikacare that we carry in our office that you can probably buy on Amazon. It's not super expensive, and it's a big sheet, so you can cut it up and apply it to the areas you're getting it. And
what is that going to do for them?
So that helps in the early stages of collagen remodeling, because remember, you can think of stretch marks like scars. So that just helps with remodeling of the skin and helping to fade them more effectively.
Okay. What else can we do in the office?
So if you have now, have had them for a long time, but they're still bothersome, then we can do things like microneedling, which uses tiny little needles that go in and out of the skin that help remodel that collagen, similar to, scar treatments. We can also do fractional ablation, fractionated laser resurfacing, like the profractional laser is one of my favorites. That's an option. Or you can do a non-ablative resurfacing, like the halo laser or the Fraxel laser. Those are great because it heals a little bit faster, and you don't have the oozing and the openness like the CO2 laser has or the profractional laser has. And then lastly, if you have dark skin, particularly what is helpful is microneedling with radiofrequency.
Okay.
So, with scars and with stretch marks, you want to do a few sessions. It's usually not just one. It's usually, 3 to 5 sessions if you want to give it kind of your best shot. But we do see them get better in terms of texture. They get more blended in, right? And you don't see them as much. So patients are pretty happy at the end of the series that they do.
Yeah, the patients that I've seen and done microneedling on, we've started doing exosomes on top just for
you could do exosomes and PRP that accelerates the healing. and some growth factors there to help with collagen remodeling. So certainly office treatments or even at home treatments are going to help improve your stretch marks, but they're not going to eliminate them. So if you go anywhere and they tell you we can get rid of your stretch marks, run fast and run away, because they're like scars. You can never get rid of them completely. Once you get a scar or stretch marks, we can improve them significantly where you don't see them, but we're not going to be able to completely remove them because they are tears embedded in the skin. So that's just something to note, but it can be significantly improved.
Yes. All right, let's jump into listener questions. I have question number 1 from Margot in Miami. She asks, do tanning beds or self-tanners hide stretch marks?
Yeah, that's a really good question because I do get this question a lot. Well, the worst thing you can do is tan, like with a UV lamp, like going into tanning beds.
My initial answer was like, yeah, they do help. Experience.
Yeah, so that will just further damage the collagen, and that's probably one of the worst things you can do. It's like having a scar and going out in the sun and trying to tan your scar. You definitely don't want to do that. But the self-tanners, the ones that use the DHEA that you can apply to the skin, or the spray tans, they can actually help. The other thing I've noticed with tanning, if you have the white ones, like the silvery kind of faded ones, when you tan, if you notice, your stretch marks don't tan. So they kind of stand out more if they're faded already or light. So regardless, UV ray tanning is a bad idea because it can make them more noticeable and further cause damage. Now, there are tattoo artists. Have you seen this where they help camouflage the stretch marks? They try to make it the same color and tattoo the ink.
Yeah.
They're almost like microblading.
Yeah.
And eventually they fade. The problem with that, I guess, if you tan...
I was just going to say, I've seen really amazing results where they blend it so nicely. But then, we live in California. If we get tan...
So that's the only caveat. So you have to just account for that, because then, that part doesn't tan as well, and it might be a different color. There's also great water-resistant makeup. So if you're really self-conscious and you do the spray tan, but you also want to use like a cover up. There are several different brands. Like one that's very common, and you can probably buy it at CVS, is the Sally Hansen leg spray.
I love Sally Hansen.
And it's water resistant, so it actually can stay on for several days. You want to apply it to dry skin, dry, clean skin. Don't moisturize before applying it, because if you moisturize, it doesn't stick to the skin as well, and it's not as water resistant. But that's a great option. It's almost like body makeup. Then there's a brand called Derma Blend that we use in in dermatology, because they make formulations that really stay on for people who want to cover their tattoos, or they have vitiligo, or their skin is like 2 different colors. So they make a lot of different shades that you can choose from. So that's nice, as opposed to, Sally Hansen that makes like 2 or 3. And they stay on. I mean, they're pretty good at camouflaging.
You just have to cover and be really good at blending.
Yeah. So use those body brushes.
Yes. All right. Listener question number 2. Jen from New York said, do bio oils and cocoa butter actually work?
Yeah, bio oil is that brand. You've probably seen it maybe, that's marketed for stretch marks. That does have a very, very mild retinol in it. I don't think it's strong enough, but it is very nourishing. So it is something you can do, just as prevention to massage the area. And cocoa butter, again, it's just nourishing for the skin. So it's going to help hydrate the skin. And we talked about how doing that may help support the skin and support the skin barrier, so that it reduces your chances of getting the tears. But there's limited studies and data with that. But hey, some patients use it and they swear by it, and I can't argue with success. So it doesn't hurt, certainly, to do that.
Perfect. Our last question: are lasers safe for darker skin tones?
Yes, depending on the laser, because some lasers are riskier, like the CO2 laser I would not do in a darker skin patient. But the erbium laser, like the profractional laser, is safe, and I've used that a lot in darker skin tones on the body for stretch marks, as well as radio frequency with microneedling. Morpheus is an example. There are others, like Scarlet is another one. That's another brand of radio frequency with microneedling. Those are safe for darker skin tones, but nevertheless, you do have to be more cautious with darker skin tones because they're just at higher risk of hyperpigmentation. And despite using some of these lasers, you can still get it, but the pigmentation can be faded with bleaching creams and so forth. So your doctor might put you on a regimen before your laser and after your laser to help reduce the chances of that.
Yeah. I really hope that our younger listeners, or really everyone listening, finds true value and really feels better about their stretch marks after this episode.
Because they are so common. I have them. Lacey has them. I see bodies in my practice every day, all day, and I can tell you the majority of people have them.
Yes.
So, and I don't think women are really self-conscious about them, but I don't think guys even care or see them. It's almost like it's so normal when I see them that I almost would be, concerned if somebody didn't have stretch marks. Like, are you human? Are you made up of plastic? So don't be hard on yourself.
Yes.
I know that they can be distressing. There are treatments out there that can help improve them. So I hope that this was valuable, and we really appreciate your listenership and subscriptionship. Thank you guys for tuning in.
Yes.
Don't forget to share this with a friend, because sharing is caring. And remember, guys, you are more than just a pretty face. You are informed, you're empowered, you're educated to make the best decisions when it comes to your skin in terms of products and treatments. So thanks for tuning in, guys.
Yes.
Until next time. Bye.